Hi, Assalamualaikum guys. So today I'm going to share with you vesiculobullous lesions of the oral cavity. You can classify them into febrile and afebrile. Okay, febrile, demam or tak demam. So under demam or febrile, if you notice, you had learned this before, under infective lesions or diseases of the oral cavity, which includes varicella zoster, smallpox, and others. Yeah, and under afebrile lesions, they further categorize them into diffuse and localized, which include pemphigus, pemphigoid, and others. Yeah. So another classifications, they tend to classify them into acute and chronic vesiculobullous lesions. So under acute lesions, again, these are the lesions associated with infection diseases of the oral cavity. And under chronic lesions, pemphigus, pemphigoid, which we will learn today. So up to you, you want to categorize them into acute or chronic, or febrile, afebrile, and there are also others classification. If you like, you can Google, which whatever classification that you chose may help you to get into differential diagnosis, hopefully during the clinic. So let's have a look. First of all, what is vesiculobullous? Okay, vesicles and bullous. Vesicles is small, bullous is much larger. Okay, so most vesiculobullous condition can affect oral mucosa. In fact, some of them can be the first sign of vesiculobullous lesion without any skin lesions. Yeah, so you may be the first clinicians that notice this, right? And then your further treatment is very important for the patients. Okay, so under vesiculobullous lesions, you may include viral diseases or other infections, and other pemphigus and pemphigoid that we will learn today. So since you learn about the viral diseases, for today's lecture, I will only focus on other lesions, other chronic lesions. Yeah, and these vesiculobullous lesions are usually recurrent or non-healing ulcerations, in which the bullous will appear and then break down, and ulcer will appear inside the oral cavity or oral mucosa. Okay, right. One of the clinical presentations of vesiculobullous lesion is desquamative gingivitis. This term is not a diagnosis; it is a presentation. Yeah. So this desquamative gingivitis can exist in various types of vesiculobullous lesions. What is it actually? If you see in this picture here, right, it's involved the gum at the attached gingiva. Maybe in this picture is only involve the lower part of the attached gingiva but not the upper part. But if you leave it the condition without any treatment, this lesion may involve larger areas. Yeah, and if you notice the free gingiva margin, there's no swelling. It's not like gingivitis. It's not like normal gingivitis presentations, in which you will notice swelling of the free gingival margin and then plaque accumulations. This is an initial presentation of desquamative gingivitis. Okay, look at the definition: a band of redness or atrophy affecting attached gingiva, may extend onto alveolar mucosa, can affect focal or extensive. In this case, is focal. Okay, commonly on buccal gingiva, then lingually. Okay, mostly seen in lichen planus, and then next pemphigoid and pemphigus. Rarely seen in linear IgA, epidermolysis bullosa, and psoriasis. Right. Okay, how to differentiate desquamative gingivitis from other types of gingivitis or periodontitis? Okay, desquamative gingivitis only involves whole breadth of attached gingiva. The keyword here is attached gingiva, and not generally associated with edematous or fibrous swelling. But having said that, if you leave the condition without any treatment. And if you notice in this picture here, there's plaque accumulations because of pain. Patient cannot brush their teeth or take a good care of their oral hygiene. Plaque will accumulate and gingivitis will occur later. Okay, so you may see patients with desquamative gingivitis together with gingivitis and periodontitis because of ignorance, not ignorance, because of the pain actually. Because of the pain, patient cannot take care of their oral hygiene. Gingivitis and periodontitis will occur later. Okay, so they may coexist, yeah. Right, so difficulty during biopsy is because this lesion is very fragile. Okay, the epithelium is very easily separated from the connective tissue underneath. And again, for these lesions, we need to take not much larger, but double the size of the normal biopsy specimen. Okay, because we want to divide them into H&E, the standard H&E, and also immunofluorescent. And misdiagnosis of superficial mucocele as vesiculobullous lesions. Superficial mucocele, sometimes they exist in multiple vesicles, small vesicles, but without pain, without erythematous. Some clinician might misdiagnose them as vesiculobullous lesions. So these are some of the difficulties, yeah, during biopsy. Right, so I want to introduce to you a term called Nikolsky sign. Okay, you may find this term Nikolsky sign when you read the textbook or articles. Yeah, it is actually an act by the clinician. Okay, whereby they put their fingers, put some pressure. This is the bullous. Okay, they put the pressure at one end, and then a bullous will getting larger because the fluid is pushed towards one side, right? So this act will create another blister or another vesicles, if you like, and this stress may share or may separate the epithelium from the base. Okay, of course it's causing pain to the patients, and it is actually non-ethical to perform this. Okay, initially it is for it's aid the diagnosis. Okay, if the lesion has a positive Nikolsky signs, then it may be one of the vesiculobullous lesions. But as I said earlier, it is not non-ethical because of you inducing another lesions and causing patient pain, right? So let's have a look at the pathogenesis of these lesions. All right, so under vesiculobullous lesions, you can find infections. Okay, another type is immune-mediated diseases. Excuse me. So I will focus more on immune-mediated diseases because these are some of the commonest vesiculobullous lesions of the oral cavity. What does it mean? It is actually an inappropriate production of antibodies by patients, causing destructions of the structures at the epithelium region. Yeah, so these autoantibodies are directed against various constituents of molecular apparatus that hold epithelial cells together or that bind the surface epithelium to the underlying connective tissue. And it is very specific. They have a specific binding of autoantibodies with the targets, right? So I'm using these normal epithelium structures. Okay, these are the keratin layer, and then you have your squamous cells. Okay, other words I usually use keratinocytes. Okay, squamous cells. And this the bottom one is the basal cells. Okay, basal cells. Holding them is the basal lamina. The bottom part here is the connective tissue, right? So these autoantibodies, they will direct it against, they will attack. Okay, attack depends on the disease. The location will be differs. Okay, for example, if they attack at the lower part of the epithelium, okay, this region will, you know, disintegrate or lysis. Okay, um, so they attack the structures that holding the epithelium together. So you can imagine if the epithelium, the glue, if you like, okay, that holding the epithelium together is being attacked, under attack, and then the epithelium will be separated. Okay, right. So what's holding the epithelium together? Desmosomes is a structure that bond epithelial cells together, and desmoglins are component of the desmosomes. Okay, so this part here you have to memorize them, yeah, because it depends on the lesions. The structures is very specific that the autoantibodies you know, will attack these regions only. For example, in pemphigus, it's very important that desmoglin 1 and 3 will be attacked, while in pemphigoid, epiligrin or laminin 5 and other components of basement membrane zone or hemidesmosomes, while in epidermolysis bullosa acquisita, type 7 collagens will be attacked. Okay, so it's okay for the paraneoplastic pemphigus. It's quite rare lesions that it's good to know, but not that important for exams. Okay, good news for you. Right, so this is a typical looking ulcers or erosions, if you like, of vesiculobullous lesions. If you see here, this is buccal mucosa. Okay, this is a very big ulcer, irregular margin. If you see here, this is what we call a mucosal tag, in which the bullous already ruptured and the top or the epithelium part has been, you know, they are located at the peripheral region after the bullous is being ruptured, okay, leaving the exposed base or the ulcer, right? So for the next video, I will be talking about specific lesions like pemphigus, pemphigoid, yeah, guys? All right, thank you. See you in the next video.